without really involvement. We have gone through more phases of collaborative projects, institutional building and capacity building, collaborations between universities in the south and universities in the north, collaboration between public health institutes in the south and in the north. But we need to take one more step. We need to really understand systems that are led by Africa. It needs African priorities. It needs to define and lead projects, and it needs to also establish its own funding opportunities for health research financing. And partners are there to help. In a way, this is about also decolonization. But that perspective is important, but the term is also about undoing. I think instead of undoing, I think we need to talk about what you need to do. You need to do the doing. And Norway and multilateral actors, philanthropic foundations are here to help. Kenya and Norway have been leading a process called the Future of the Global Health Initiative. And in short, that is about to get a more effective, efficient, and equitable global health system that can put countries in the driver's seat, where we can have country-led plans, budget, and implementation. This goes for health care and health delivery and public health, but it's also equally the same perspective required for health research. Country-led health research partners and partners.
Thank you very much. Invest in talent. I believe the talent is here in Africa, talent amongst all of us, especially the youth who are here with us today. I want to go now on to Mr. Malo, Interim CEO of Gavi. Gavi is nearing its 25th birthday and has reached more than 360 million children in Africa with vaccines. What do you think new vaccines like the RTSS vaccine against malaria and other new technologies will help us achieve over the coming years? And what partnerships will Gavi need in order to most effectively deliver?
Excellencies, ladies and gentlemen, thank you for having me here at this special event. I also do want to just start to congratulate the African Union, the African CDC, Mastercard Foundation. It's a wonderful milestone. I was part of the Mastercard Foundation for 4 years, where I really spent a lot of time making the first phase of saving lives and livelihoods reality. So great congratulations to you all. Gavi's mission is saving lives and protecting the health of people through equitable access and sustainable use of vaccines. Why it's also very important to tell you what we are doing specifically in these 3 areas of vaccines, technology innovation, and most importantly, also strategic partnerships. With regards to vaccines, we also need to remember that we have to start with the existing vaccines. After the pandemic, the zero-dose children has increased versus the 2019 pre-pandemic period. And most of these zero-dose children are on the African continent, with Nigeria having 2.3 million zero-dose children out of 10.2 million. So we really have to continue to focus on routine immunization. Secondly, last week was a huge milestone because we delivered the first malaria vaccines on the African continent. That was after hard work by 3 countries, Ghana, Kenya, and Malawi, that were the pilots. And the new news now is that in October, the WHO has also recommended a second malaria vaccine. We are hopeful that this vaccine will get the WHO pre-qualification approval and that we can start implementing this vaccine in 2024. With regards to technology and innovation, there is already a lot of technology in Africa at work. Drones are being used in Rwanda, Ghana, etc., for delivering of vaccines. But there's more to be done from innovation perspective and really partnering with the private sector. Digital identification is one, where, for example, technology now allows fingerprinting of infants of 9 months old. Furthermore, within Gavi, we are very much focused on innovative financing. And the process of working on a financial instrument is called Africa Vaccine Manufacturing Accelerator that will support the ambition of local manufacturing on the African continent for vaccines. Obviously, it would be wonderful if a priority antigen would be the malaria antigen. With regards to partnership, I would highlight the work that we are continuing to do with the Africa Union, the Africa CDC. Recently, we signed a memorandum of understanding with the African Union to strengthen our work as it relates to the private healthcare systems, as well as diagnostic and surveillance equipment, which is so important to detect these diseases, specifically in the outbreaks. We have also been working tirelessly with the African Union, Africa CDC, to bring manufacturing to the African continent. And last but not least, we will also continue to partner with other entities such as the Global Fund to help with the eradication of malaria on the continent, because vaccines is only one tool out of a toolbox that need to work together to support this terrible disease eradication. Thank you, and back to you, moderator.
Thank you very much for those remarks. I'm told that the Zoom is not working, so unfortunately, we will not hear from our two colleagues, Ambassador John Nkengasong and Mr. Peter San. Usually when you have a panel, people are itching to ask questions. In this case, you are not allowed to ask questions. But since we are missing out on two speakers, I want to go back very briefly to our panelists. We are breaking barriers and repositioning Africa in the global health architecture. If you had 30 seconds to tell us just something on strategic partnerships towards this theme that we have selected, what would it be? And I'll start from my immediate right.
I would say from my perspective, it's the voices of the countries that matter. The countries are our client, and we need to listen to their priorities and needs and build that into the work that we do in a collaborative way in country with other partners.
For me, let me quote an African proverb that says, "The rain does not fall on one roof alone." So reinforcing we're all in this together. And so whether it's countries, whether it's communities at local level, let's stand together and let's see where the value sits, enable that value. And I see the greatest value in the young people on this continent. They will safeguard this continent. Thank you.
The young people you are clapping, it's a big challenge to you, so get ready to take it up. Thank you.
I would like to speak on the issue of collaboration, which was one of the seeds we learned from Fantasia. And I just want to share that none of the Nordic countries have vaccine manufacturing capabilities to deliver vaccines to our own countries. So we rely on partnership and collaboration with other countries. My call to Africa is that you will also need to rely on each other. Take different parts of the vaccine ecosystem, collaborate, and make sure that you collectively can deliver self-reliance, but still in a collaborative manner with the rest of the world. fully independent, it's inefficient. We need to trust each other within the continent and across. Thank you.
I think for me, in 30 seconds, if there is political commitment by all our people, anything, all thank you.
Thank you very much. We must listen to the people on the ground. We must trust each other. We must work together. Above all, we need serious political commitment. Thank you so much to our guests who have been here with us. It's been wonderful to hear your opinions, and I'm sure the audience feels the same. Please enjoy the rest of the conference. Thank you very much.
Another round of applause for Professor Gephardt and her panelists. Thank you all of you for sharing that. I am indeed reminded of the African proverb. If you want to go fast, go alone. If you want to go far, go together. Thank you. Now I'm pleased to introduce the next segment of our program, and this is the CPHIA Lifetime Achievement in Public Health Award. This distinguished honor is awarded to an exceptional individual whose lifelong dedication and contributions have advanced the field of public health across the African continent and around the world. The recipient embodies an unwavering commitment to improving the well-being of the African people and the resilience of its health systems. I would like to invite to the stage His Excellency Dr. Jean Sia, Director General of the Africa CDC, to announce the recipient of this award that's led with moral clarity, courage, and integrity throughout his career. Your Excellency.
Excellency, dear colleagues, ministers, head of agencies and institutions, leaders of delegations, young people. This is the time for us to dream. This is the moment I hope all of us, we are dreaming to see it before we pass on, because we need models. Today, we'll celebrate an exceptional person. But I say, it's not just Africa CDC. I have decided to break the protocol with the permission of His Excellency. I wanted to invite with me my sister, Dr. Moiti. Please come to join me, Dr. Moiti. While she's coming, I will make a few words. It is with great pleasure and honor that I stand before you once more to present this lifetime achievement in public health. This award is a celebration of individuals whose extraordinary contributions have left a lasting mark on public health and health research across the continent. In 2021, this award was presented to Professor Jean-Jacques Muyembe for the role he played in advancing Ebola research. And let me tell you that WHO followed Africa CDC decision because they awarded also Professor Muyembe during the WHO 2023. Thank you, Dr. Tedros, for that. In 2022, it was Professor Salim Abdul Karim, who is significant, who contributed significantly to research in HIV prevention and treatment. Today, my sister Mwete and myself, we recognize an individual whose unbelievable commitment to public health has transcended borders and reshaped the global health landscape. This award is not just a token of appreciation. It's a testament to a lifetime of service, passion, and dedication to the well-being of communities far and wide. Today, we pay homage to a man whose leadership has been characterized by moral clarity, courage, and unbelievable commitment to the principles of equity and justice. The recipient for the 2023 CPHI Lifetime in Public Health Award is none other than my coach, the person I've coached every week. My friend, the person I have to trust, and my big brother, Dr. Tedros Adhanom Ghebreyesus. Throughout his tenure at the WHO, Dr. Tedros has exemplified what we call the transformative leadership, steering the organization through complex global health challenges with resilience and humility. His commitment to ensuring access to healthcare, promoting equity, and tackling emergency health threats has left an undeniable impact on the lives of millions around the world. Additionally, Dr. Tedros played an instrumental role in the establishment of what we call Africa CDC. For all of you who don't know that, it's in 2013 when he was Minister of Foreign Affairs during a meeting in Abuja that for the first time he said, why we cannot create a continental organization called Africa CDC. It was the first time someone talked about Africa CDC. If you want to know who the founding part of Africa CDC is here. His commitment to championing the international health regulation and the pandemic agreement, which constitute the international legal framework for enhancing pandemic prevention, preparedness, and response, stand at a beacon of inspiration for all of us, a testament to the impact one individual can have on the health and well-being of humanity. I want to hand over to my sister, Mwen. She has to work with Dr. Tedros for a very long time. She's also a sister and a friend of Dr. Tedros. I wanted to say a few words for Dr. Tedros before proceeding.
Thank you very much, Dr. Jean, the DG of the Africa CDC, and good afternoon to this amazing collection of partners, young people, leaders, ministers, and with all respect to Your Excellency. Thank you for having hosted us. So it's very difficult to talk about your boss, your inspiration, who's 10 years or so younger than you. But I'd like to really, on behalf of all the staff in WHO, particularly on behalf of my colleagues in the African continent, in the African region, say how proud we are of you, Tedros. How much we believe, how much we really believe you deserve this recognition by the Africa CDC. I was privileged to be at that meeting when you proposed, at that time I was the assistant regional director, I think, when you came up as the Minister of Health for Ethiopia with the idea of establishing the African CDC. I've followed and worked with you as the Minister of Health. I've been privileged to interact with you when you were the Minister of Foreign Affairs in Ethiopia, in the African Union. And I have been really inspired by your leadership, your team, and all of us as your regional directors in all the regions of WHO. Have been inspired by the transformation that you've made in WHO itself, in seeking new ways of working, new partnerships, new funding, and particularly in emphasizing and inspiring those of us in Africa, the importance of working with our communities, our young people, creating the space, and being an example in doing that in our health sectors. We've worked very much in the African region along that line. We have established a UN volunteers program for young women, of which I've been very proud. We've managed to mobilize more than 300 young African women to join WHO in Africa and make their path up into other regions and headquarters. That was part of what you inspired us to do. I know that you work, you lead from the heart, and you lead from your brain. And that has made you encounter some challenges in the openness, in the preparedness to change the way WHO works, in your readiness to challenge normalities that have been accepted in the global relationships between the North and the South, and particularly with Africa. Sometimes that may be difficulties. Some countries have decided to withdraw their finances from WHO for a while to punish you for your vision and your leadership. We are proud of you. And we'd like you to continue to work in this way with your particular focus on equity, justice, people, and international institutions and organizations that take that as moral responsibility, and then working on the strategic ways to make that happen with all sorts of partners. We're inspired by the way in which you are looking to diversify the sources of funding from WHO, because that will also help us to be a better partner to our member states. So, younger brother, my dear boss, I'm really proud of you, and well done to have you well deserve this recognition. Thank you.
Excellency, dear colleagues, you'll be surprised. This is the first time, the very first time, for Tedros to receive an award from Africa. Then, who am I? That general capacity, I don't have the power of head of state. I was talking to the president of Comoros, who say we are represented, all of us, by His Excellency Aikande Ichilema, and Her Excellency the Prime Minister of Namibia, who will come to award Dr. Tedros. Please, let us stand and invite our leaders to come. Thank you, our leader. Dr. Tedros committed that he will not cry. I think he will stick to his commitment. I'm there. If you want to cry, just look at me. We want to give him opportunity to say a few words. After that, we'll watch a video of a number of leaders who wanted to recognize this moment. Dr. Tedros.
If I stick on the paper, then no crying. Your Excellency, President Hakainde Hichilema, Your Excellency, Prime Minister Sarah Wahele, Honorable Minister Sylvia Masebo, and my dear sister Shidi, and my dear brother John, and the co-chair Margaret, dear ministers, by the way, not only from our continent, we have ministers from the Caribbean also. I don't know if there are others, but Mr. Tuat from Barbados is here. That's why I want to recognize. And this platform is also being used to strengthen the Africa-Caribbean partnership. And really glad to see how CPHA is growing. As a proud son of Africa, I'm deeply humbled to accept this award. I thank the African Union and the African CDC for this great honor, especially my brother John, for this great honor. Thank you so much. In 2013, when I was foreign minister of my country, Ethiopia, I was fortunate to chair the Foreign Ministers' Council in the development of Agenda 2063. That was the 50th anniversary of OAU, and also 10 years, I think, after African Union. The blueprint that Agenda 2063, as you know, we call it the blueprint of the Africa we want. Agenda 2063 was built on 7 pillars, including health. In support of that pillar, it was at that point that we started discussions about building continental institutions together with my fellow foreign ministers and also ministers of health. And that's why, as John said, in July 2013, at the meeting of the African Union, for the first time, the idea of the Africa CDC was proposed. Since then, a lot has been done, including the establishment of Africa CDC and the African medicines agency, especially African CDC, has grown from strength to strength. And I consider Africa CDC as my daughter, and I'm glad to see my daughter growing from strength to strength. After my election as Director General of WHO in 2017, I continue to support the strengthening of the Africa CDC and AMA. And we have continued to support a healthier Africa through other initiatives, including the mRNA technology transfer hub in South Africa with my sister, a very important initiative that we think will address the equity problems that we faced during the pandemic. But even more important than investments in institutions is investments in human capital, in people, especially in our young ones. This is one of the other priorities of Agenda 2063, the Africa we want. For too long, young African public health professionals have not had the opportunities they deserve at WHO. We have begun to change that by transforming our internship program, paying our interns for the first time, and also establishing the Young Professionals Program. As you know, this year WHO marks WHO's 75th anniversary. We were founded in 1948 as nations sought to build a new world together in the aftermath of the Second World War. Our Constitution begins with two important affirmations. First, that health is a fundamental human right for all people. And second, that the health of all people is fundamental to peace and security. 75 years later, those words are more relevant than ever. And I remain more convinced than ever that a healthy Africa is the foundation of the more prosperous, more secure, more equitable, and more peaceful Africa we all long for. And you know the African proverb, horns do not grow before the head. In the same way, health is not a product of strong and prosperous nations, it's the foundation. Of course, it can be also a byproduct of prosperity. A healthy population is a productive, innovative, and resilient population. And the best way to protect and promote the health of a population is to make sure all its people can access the health services they need, where and when they need them, without facing financial hardship. That's why WHO's top priority remains universal health coverage built on strong primary health care. Our continent is the birthplace of humanity, and it will play a vital part in the future of humanity in the coming century and beyond. Our continent is home to some of the richest resources on Earth. I don't mean the resources buried underground. I mean the ones above the ground, our brothers and sisters. I mean the human capital and the human resources. They are the future of our great continent, and they must be the focus of our investment now. It took almost 75 years for WHO to have the first African Director General, but it will not take another 70 for the next one. Maybe they are a child growing up poor and in midst of conflict, like I did. Maybe they are a student like I was. Maybe they're working to promote and protect health at the local level, like I did. Maybe they're working in government, as I had the honor to do. Who knows? Maybe they are in this. Thank you so much again for this great honor. And I accept it with a mixture of pride and humility, not only on my own behalf, but on behalf of all my colleagues at WHO who work every day, sometimes in difficult and dangerous situations, to protect and promote the health of the world's people. And especially humbled to receive this award from the hands of His Excellency President Chilema and Prime Minister Serra. That gives me more honor. Thank you so much. And I would like to use this opportunity also, Your Excellency, to recognize your leadership, both global, continental, and your own country, because I know your commitment to health. So thank you so much for your leadership, Your Excellency, and for the change you're making, which I fully agree with what John Kasea had already outlined. By the way, I gave him an Ethiopian name because I misspelled his name, Kasai. Kasai. Very close, Kasai. Africa has made me who I am. And I hope in some small way to repay the debt I'm indebted to our continent, Africa. Thank you. Yeah. Okay. Maybe one thing I would like to say, when John said I haven't received awards from Africa, it's from African Union, because I have been chairing the foreign affairs, the Africa CDC, many things. From Africa, though, I would like to recognize the recognition from His Excellency President of Senegal. I think this was in early, actually, 2017-18. And then from Benin also, President of Benin. And then from South Africa as well, recently. So thank you so much for all this recognition. And I really appreciate it. And this one, you know, which I accept with pride. Thank you so much indeed. Thank you. Thank you. Don't forget that. This is mine.
Yeah. And to close, there is a video of a few people, respected people, who say we want to make our voice for Tedros to know how we love him and how we respect what he's doing. I hope we can have this video and we don't have network challenge. Please, the video for Tedros.
In a world shaped by leaders, one stands out, guiding with moral clarity, courage, and transformative vision. Today, we honor this leader, Dr. Tedros Adhanom Ghebreyesus.
Dr. Tedros has been changing lives for the better for several decades. He has always had the courage to challenge the status quo, never shying away from what others would consider intractable challenges. He continuously demonstrates he is relentless in doing what's right for people. From vaccines to reproductive rights, during his tenure at the WHO, we have seen just how uncompromising in his commitment to stand by science and evidence.
In the realm of global health, Dr. Tedros has left an indelible mark as a champion of universal health coverage, a cause that transcends borders and addresses fundamental human rights. His impactful work also extends to the strengthening of individual countries, ensuring better resources, empowered personnel, and supporting ministries of health to fulfill their vital roles and enhance the overall impact where it is most needed. Under his leadership, WHO has confronted challenges like the 2018 to 2020 Ebola outbreak in the Democratic Republic of the Congo and the unprecedented global impact of the COVID-19 pandemic. During one of the most significant health crises in human history, he showcased exceptional leadership by coordinating the global response to COVID-19, combating misinformation, and advocating for vaccine equity and international cooperation.
When I have to talk about Dr. Tedros, sometimes I feel emotional. That person is just amazing. Dr. Tedros was not elected Director General just because he's a politician. He created innovation on the way to lead public health in Africa. Thank you for what you are doing. You have a lot to share with the world. You have a lot to share with Africa.
Dr. Tedros has not only made significant contributions to global health, he has also been instrumental in promoting gender equity through WHO's work. His impact resonates across generations, borders, and disciplines, serving as an inspiration for all who seek to make a difference.
Dr. Tedros is a true champion for health for all. He has put the health of all people first. I'm glad to be on the same team as Dr. Tedros. So, Dr. Tedros, keep up the good work. We are with you.
Today, we celebrate Dr. Tedros for his leadership, courage, and integrity, and present him with the Lifetime Achievement in Public Health Award. Congratulations, Dr. Tedros.
One more time, a very big, big round of applause for Dr. Tedros. Well-deserved honor. So congratulations once again. Well, I think it's only appropriate now that we have some celebration, yes? And we're going to invite the National Dance Troupe. They will perform in the aisles. Those of you that may not be able to see them clearly, we ask that you just focus on the screens. We will beam their performance on the screens. And this is really to celebrate Dr. Tedros today, and also to welcome all the delegates that have come from outside Zambia to our lovely country and give you just a little glimpse of some of the cultural experiences that we have on offer here in this country. So let's put our hands together for the Cultural Dance Troupe as they come with their performance. Thank you. Thank you. Like I said, that was just a glimpse, a snippet of the vast, rich traditions that this country has. And I'm sure many of you saw some semblance of some cultures, maybe from some neighboring countries. Yeah, we all are one after all, aren't we now? And we have 10 provinces, a total of 10 provinces in this country, all corners, northeast, west, south, northwest, everywhere else. And if you visited any of these provinces, you'd be sure to see at least one of these performances. Or better still, if you visited any Zambian home, I can guarantee you will get that performance to welcome you. So visit any Zambian home, mine included. I'll dance for you personally at the door to receive you. So that is Zambia. That is Zambia, just what we have on offer. Now, I'm honored to invite again to the stage the Honorable Minister of Health of the Republic of Zambia, Honorable Masebo, to come and invite Her Excellency Sarah Ubongelwa, the Prime Minister of the Republic of Namibia, to deliver her remarks. Let's put our hands together once again for Honorable Masebo.
Your Excellency, the President of the Republic of Zambia, Your Excellencies, Ministers, Deputy Ministers, and let me just say all protocols are observed. It is now my honor and privilege to call upon our Deputy Prime Minister, Madam Sarah. Prime Minister.
Ministers and members of Parliament of the Republic of Zambia and from other countries, distinguished delegates, ladies and gentlemen, all protocol observed. I join other speakers to commend the Republic of Zambia for hosting this third international conference on public health in Africa, an important forum to unpack weighty matters of health on our continent, and for the warm hospitality extended to us since our arrival here in this beautiful country of Zambia. I convey fraternal greetings to His Excellency Mr. Hakainde Hichilema, President of Zambia, from his brother, His Excellency Dr. Hage Gottfried Geingob, President of the Republic of Namibia, who is unable to attend this event due to equally important national duties and has thus delegated me to represent him. President Geingob extends his very best wishes for a successful conference. Good health is the foundation for life. Our continent will not develop and prosper unless the citizenry enjoy good health and access good quality healthcare services. We need to put in place robust, resilient, and sustainable healthcare systems built on a foundation of primary healthcare. In line with Goal 3 of Sustainable Development, Namibia acknowledges the centrality of investing in robust, resilient, and sustainable health systems, particularly for pandemic prevention, preparedness, and response in order to protect lives, livelihoods, and economies. We are further guided by the African Union Agenda 2063 to put necessary resources in place for the attainment of health security for all. The theme of this conference underscores the urgency of our mission. It beckons us to envision an Africa where health disparities are reduced, where access to quality healthcare is a reality for all, and where health outcomes rival the best in the world. To achieve this vision, we must engage in thoughtful discourse, exchange innovative ideas, and forge partnerships that transcend borders. Namibia has established a robust community health workers program since 2012. This program is funded by the government with over 1,600 community health workers currently on the government's payroll. This initiative is in line with the African Union's objective of reaching a total of 2 million community health workers. Thanks to this initiative and other efforts, Namibia has achieved the 92, 98, 94 on UNAIDS cascade, significantly reducing morbidity and mortality associated with HIV/AIDS. Namibia is also committed to domestic financing, with the government providing funding for 85% of healthcare services in the country. Namibia has further successfully incorporated COVID-19 vaccines into its routine vaccination program. This accomplishment was made possible through the unwavering commitment and effective leadership of His Excellency Dr. Hage Geingob, the President of the Republic of Namibia. In taking cognizance of the interconnectedness between humans, animals, and the environment, Namibia has embraced the One Health approach as a vehicle for public health safety and the prevention of public health threats emanating from the shared environment. As the One Health approach cuts across human, animal, plant, and environmental health, the ministries responsible for these sectors in Namibia have established a collaborative network to strengthen public health emergency, preparedness, and response activities. Namibia, with support from Africa CDC and other partners, is in the process of formalizing the One Health multi-sectoral coordinating mechanism through the development of a national One Health strategy in accordance with relevant national laws, which will pave the way for better coordinated efforts in protecting human, animal, and environmental health. I thank you for your attention.
Thank you very much, the Prime Minister of the Republic of Namibia, Her Excellency Sarah Gongelwa. May I invite again our Minister of Health to please come up. She's very healthy. She's the Minister of Health after all. So she's fit enough to make these treks back and forth to the stage. Please come forward now.
Thank you. And my apologies, Madam Prime Minister, for preparing us to deputy our Prime Minister for Your Excellency and Your Excellencies. It's now my rare privilege and honor to call upon His Excellency, the President of the Republic of Zambia, none other than Mr. Hakainde Hichilema.
Thank you. You may take your seats, please. Thank you very much. Thank you very much. Let me start by recognizing the Prime Minister from our next door home, Namibia. And I'm very grateful that you are here. President and I were chatting last night, and they confirmed that you will be here. So thank you for being present, Prime Minister. Let me also recognize my colleagues in Cabinet, and also Cabinet of Zambia, but also cabinets from other African countries, and those from outside our continent, and the deputy ministers, provincial ministers that are present. Let me acknowledge them.